Hello, my name is Chris, but that doesn't matter. What matters is the research that I've done from respected journals written over the past 30 years about fluoroquinolone toxicity. The amount of different doctors that I've talked to, from MDs to neurologists to rheumatologists, that understand fluoroquinolone toxicity. Right now, you are sitting with a fluoroquinolone toxicity patient who really, really needs your help. Please listen to them. Please listen to these facts to help your patient as much as possible. I have studied and talked to biochemists across America who have confirmed that these are the steps that happen after fluoroquinolone toxicity. See, we develop many free radicals, which are unpaired electrons in our body. And I'm going to tell you exactly the steps what happen, prevention of further damage, and some different ways and things that we would love from you, our doctor. So, step 1, your patient has taken a fluoroquinolone antibiotic, ciprofloxacin, Lavequin, the list goes on. Step 2, type 2 and type 4 topoisomerases have been inhibited. So there's many studies, there's many research papers out there that show and confirm this. Our nuclear DNA has also been inhibited, which leads to interruptions in our Krebs cycle. This creates reactive oxygen species. Free radicals are now overwhelming our defense mechanism and leading to cell damage. Lipid peroxidation is now occurring. We know this by the hardening of our arteries, the double amount of heart conditions that are seen after a fluoroquinolone antibiotic treatment. This also can create tissue damage. So right now, your patient is probably in pain from some sort of damage to their neck, to their back, somewhere they have tissue damage. See, the lipid peroxidation leads to more ROS and leads to tendinopathy, tendinosis, tendon ruptures, and tears. Now, this science cannot be argued. We have seen black box warnings for these. We've also seen warnings that show inability to walk, nerve damage that never goes away, PN, and other things because of this. We also know that the brain and the heart need the most mitochondria inside to function properly. So your patient might be having heart palpitations or brain issues like brain fog, inability to read, and other things. See, all of this, which I'll get to the mitochondria function in a few seconds, but all of this is redox status, which is a balance in our cells that is off. Redox modulation is the altering of our DNA and our RNA and lipid damage that we have occurring in our bodies. So the oxidation of our DNA will lead to single and double DNA breaks. This is very important to understand how serious this condition is. And through this cycle, our mitochondria is being damaged because of muscle atrophy, weight loss, and many other things that I just said. See, we had 55 fluoroquinolone toxicity members go overseas for a study in which all 55 showed this DNA adducts from the fluoroquinolones. All 55 were severely damaged in their mitochondria, some even showing single digits of mitochondria functionality. Many patients are misdiagnosed with fibromyalgia and other symptoms and other diseases and things that is just not the case. This is a fluoroquinolone toxicity. It may lead to lupus and fibromyalgia and other things, but we have to address the fluoroquinolone toxicity to heal. Things that you can do. The right testing. Even if testing all comes back negative, that doesn't mean that these things are not happening, because most tests don't show what I'm talking about. But inflammatory test, cortisol test, things like this, nutritional test will really help your patient understand what steps to take next. When I was in the emergency room, an emergency room doctor told me that a patient came in 3.5 years later with a ruptured Achilles tendon. In surgery, the tendon was completely dead, she said, and they biopsied it. 3.5 years later, the fluoroquinolone was still in the tendon. This is a cycle and a long journey back to health. So please stay active and patient with your patient. Things to avoid are steroids, NSAIDs, and even Tylenol can create free radicals in your liver. So please be very careful in what you give your patient. Now, I'm not telling you how to do your job. I'm just making you aware of the dangers behind these antibiotics. There are many black box warnings that show these permanent damage, and we encourage you just to look inside of the pamphlet that is given while prescribed these antibiotics. Thank you so much for taking your time to watch this, and I hope that you can get your patient back to health.